but I think it's a really important area that we need to go into.
And is it different in Nova Scotia than it is in other places, in other parts of the country, you think?
So my research is primarily, right now, we're doing a lot of work in staffing and long-term care, and so what we're finding is, so Alberta, who's our partner on this project, the proportion of the people, we call them CCAs, and continuing care assistants, the frontline personal care workers in nursing homes, they are about 85 to 90% newcomers. So people from the Philippines or from India, Nova Scotia and Atlantic Canada, we're just moving along that pathway now. And so even for our research, trying to understand the experiences of the workers from that point of view in terms of their own mental health, in terms of the work environment in which they are providing care to residents, I think has provided some insight. So I know we have a postdoc here and another master's student that are working in this area, so it's really important because they also send a lot of money back to their home country as well. So not quite the actual older persons, but in another sort of lens into understanding.
And part of that, I think, is that there, in certain parts of the world, there is much more a caring culture towards folks who are older than there are in North America, where, you know, as you said earlier, when do I put mom into the home as opposed to how are we going to care for mom or dad? Any thoughts?
Well, just back to the research, like we really need to listen to people's own voices, and so there has been much more move toward having people embedded within the research teams themselves who have the lived experience and who are older adults themselves, who are from different communities. If we're going to be doing research with a community, you have to make sure to develop the research project with them so it answers the right questions. Because I've been on research teams where the team is like, oh, this is great, here's the questions we're going to address, and then the person sits there and goes, that's a stupid question. You know, you shouldn't ask it that way. You know, we should, here's what matters to our community. So definitely it's important.
Linda?
I'm from a large family. It was a family of 9, and I'm in the middle. And as a young person, I always asked a lot of questions to the older folks, you know, just the way I was, because I always felt that they knew a whole lot more than we did as young people. And I know a lot of young people, you know, they think sometimes they know everything. You know, we went through that phase too. But eventually I came to realize that they know a whole lot more than I do. And I would ask a lot of questions. We were allowed to ask questions in the family, and sometimes the answers weren't what we wanted to hear, but, you know. And if we didn't ask questions, it was like, okay, little girl, you have a little seat there. We have to have a little talk. Well, what, Mom? You know that little boy you're seeing out there? No, he's just my friend, Mom. And then we get into, you know, the conversation. But that's how it would go. Just very simple, like that. But I always, when I look back and I think, you know, back in the day when people had large families, they had to be organized. You know, they had to know what they're doing. You know, and I figured, well, if they know what they're doing, I need to learn a little something, something from them. So I need to ask questions. And they didn't mind you asking questions. And they were going to tell you the truth, too. You may not want to hear what the truth was.
Do you think that's still true today, though?
Oh, I think so. Because I find I'm very shocked with this generation with some of the questions that my grandson's asking me. I said, oh, you don't know that answer, right? Interesting, you know, because I'm thinking. But yeah, I think, and I think that's a real good thing. If we could keep that going, you know, having younger people ask the older people questions, because they've been here, they've had experiences. And take a listen. We may learn a little something from our older folks, and now I'm one of the older folks, and I'm just saying.
And do you think that would go a long way to kind of getting, to tackling the problem of ageism, if there were a lot more conversations intergenerationally?
I think so. I mean, I think the intergenerational aspect of it, we keep people apart, you know, and I think it's getting to know individuals that really gives a different perspective. I teach intro to aging, so this is students, a lot of them coming right out of high school, they get into my class, and I'm going on about older people, and trying to help them understand, because I think sometimes, you know, they have grandparents, et cetera, but they don't always understand the difference, like the diversity within the group, right? So we lump people together, like 65 and older, or 75 and older, but those 75-year-olds, they've had a heck of a lot of different experiences, and so that shapes who they are, as Danella was saying, like, ask about the individual too. And I think that's a really important aspect, that are having that more intergenerational contact helps people to not be afraid, you know, and be respectful. Like, I make them go out and find all those crazy cards that are ageist. Do you know how many ageist cards there are out there for birthdays, etc.? I mean, they're everywhere. They're just pervasive. And Melissa, you can talk about your recent study that, you know, around the U.S. election and how older people were portrayed. Like this idea, it's ingrained in these guys' heads, right? Because they see it on media or in social media and Twitter and, you know, Facebook or wherever, and of course you don't use Facebook anymore, apparently. That's not great. I hate myself. Anyway, I know that there's a really interesting research that you guys have just published in the Gerontologist.
Yeah, it's timely. This paper just came out last week about ageism on Twitter during the U.S. election. And so that, of course, that's got its own issues in this election. But just like analyzing the content of people's tweets and how they feel quite empowered to say the most terrible ageist things,
Hey,
and
Boomer.
dehumanizing, and so much stigma. And it actually got to the point, it was coming up so much, like people would say, like, Dementia Joe. It was a terrible thing that came up a lot. And I remember typing into my word processor, and it was doing the AI predictive thing, and I wrote the word dementia in a paper or something, and Joe comes up afterwards. I'm like, oh my gosh, like, it really is pervasive. And so what we were hoping to do in the course of that study was to just bring up some awareness of how, you know, some of the hated vitriol that is happening on Twitter is actually feeding this ageism, which in itself is not good.
You know, in your organization, do you find that people lump everybody into kind of one big mass?
Excuse me, it's challenging because, you know, I'll tell you one thing, language is very important around how we see ourselves. And so, I think, senior long-term care.
It's hard enough.
So, all you see is, okay, every senior is going to long-term care. So just that in itself, part is trying to change the attitude around how you see yourself. And you know, it's important that people actually start taking charge of how we actually see ourselves. And that we stop allowing ourselves to be lumped together as other people.
And anyone who's received a government pamphlet about aging or some seniors grant or whatever, what is the picture they show?
They show seniors and older senior, you know, and you always see seniors ready to go either, you know, a long-term care facility, or they're wrapped in a blanket. Nobody ever sees you dressed and ready to go out, or we see a positive picture. So we portray older people in a negative way. Perfect example. Older people, we are the problem with the healthcare system. I mean, I was little when I was still hearing how older people are going to be the problem with the healthcare system. So sooner or later, you have to figure out if it's not the older people that's the problem with the healthcare system.
And it's also, especially during COVID, there was such a